On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 7 o'clock, a former Israeli Prime Minister has told LBC he doesn't believe the country wants a full-scale war with Hezbollah. At least 9 people have died in a second wave of explosions in Lebanon, which have targeted walkie-talkies. It comes a day after pagers were detonated. Ehud Barak has told Tonight with Andrew Marr Hezbollah fighters were injured, not civilians.
Compared to our operations in wartime, among nations, especially those who are fighting terrorist organization, even if some innocent people were killed, that's pity. Hopefully, it not been happened. But out of 5,000 explosions, about 20 people killed. It's probably painful, but that's not a disaster.
Train drivers with the ASLEF union have overwhelmingly accepted a pay deal ending their 2-year dispute. 96% of members back the terms, which will see their wages increase by 15% over 3 years. Staff walked out for 18 days across 16 train companies during the industrial action. ASLEF General Secretary Mick Whelan has said rail workers are pleased with the outcome.
I think that they are pleased. It's reflected in the high turnout, but they're more pleased that they've retained their futures and the conditions that they've fought and paid for over the last 140-odd years. And let's not forget, we didn't claim a pay rise for 2 years of COVID, so some people have been without a pay deal for 5 years.
Ukrainian drones have hit a large military depot in a town deep inside Russia, causing a huge fire and the evacuation of some local residents. Kyiv says the strike destroyed warehouses holding missiles, glide bombs and artillery shells. Meanwhile, the Russian ambassador has been summoned to the Foreign Office after 6 British diplomats were expelled from Moscow last week. The Kremlin accused the staff at the British embassy of spying and sabotage. Campaigners have welcomed a new law aimed at protecting women going to abortion clinics in England and Wales. From the end of next month, protests will be banned within 150 metres of centres. Some have argued it's an infringement of free speech. But Labour MP for Walthamstow, Stella Creasy, has told Andrew Marr it strikes the right balance of rights.
The point about safe access zones and buffer zones is they balance those rights. They say this is a place where people are making a choice and we have decided. And I want to be very clear about this because Parliament explicitly considered the idea of an exemption for silent prayer and said, actually, it's right that we say the privacy of women trumps your ability to pray where you want to. So you can pray for women who are having an abortion. You can oppose what they're doing. You just can't do it in their face when they're choosing to have one.
Interest rates are unlikely to be cut tomorrow after inflation held at 2.2% last month. A fall in the price of fuel was offset by higher airfares. And food container manufacturer Tupperware has filed for bankruptcy in the US. The company, which was founded 78 years ago, says it's seeking a buyer to protect the brand. It became a household name in the 1960s, 70s and 80s through Tupperware parties where people sold their products. In the city, the FTSE 100 has closed down 56 points at 82.53. The pound buys $1.31 and €1.18. LBC weather staying dry tonight with some low cloud moving in from the east for most. Clearer in the far west and parts of northern Scotland, a low of 6. Cloud breaking up for most tomorrow to leave sunshine, a small chance of a shower in the south, a high of 26 degrees. From Global's newsroom for LBC, I'm Amelia Cox.
This is LBC from Global, leading Britain's conversation with Iain Dale.
Hello, a very good evening. It's 4 minutes past 7 on LBC. I'm Iain Dale. We are streaming all 3 hours tonight, at least I think we are. Oh, it's certainly streaming the 9 o'clock hour with James Cleverly. It's the second of our Conservative Party leadership contender hours. He'll be taking your calls as well. That's after 9, of course, after Cross Question. But in this hour, certainly for the first part, we are going to be talking to the Health Secretary, Wes Streeting, who's with me in the studio. Wes, hello.
So you're definitely live streaming James Cleverly. What am I, chopped liver?
Well, if you'd been here for the whole hour, we would definitely have streamed it live. But maybe we are. But we are. So don't get offended. Oh, God, you're so touchy. What happens to these ministers? They get into
because
government.
I heard your trail before I came on. I thought, right, OK, that's how you play. I only came on out of concern for you losing your gallbladder. Now I've learned you've lured me in to give me a kicking.
I'm not going to give you a kicking, but I do want to know what you mean by reform. But we'll come on to that in a second.
Let's talk about your experience, though.
Well, because I was your mystery shopper, wasn't I?
Yeah, so for benefit of listeners, so obviously I've been following your trials and tribulations like everyone else. And although you had told me where you were being treated, I'd forgotten. So as you were going into your hospital appointment, I tweeted saying, like, good luck, I'm really grateful to you for being my NHS mystery shopper, forgetting that you were going private. So people point this out, I thought I'd better delete that, I'm going to look completely daft. But actually, there is a serious point here, which is you have been my mystery shopper in the NHS with the experience, and the outcome of your mystery shopping exercise is that you decided to shop elsewhere because the NHS wasn't there for you when you needed it.
Well, it was, and this is where I think, and a lot of the doctors and nurses confirmed this. They said, look, the NHS is brilliant at emergency and acute care, but it's the elective care side that is the problem. And of course, I was faced with a situation where they said, look, you can't have the operation for 6 weeks because of the infection. And then they said, but you'll have to wait 18 weeks after that. And I'm thinking, well, that'll be December. Yeah. And they told me that I'd be operating at 60% capacity until then. Yeah. I thought, well, I can't present a 3-hour radio show if I'm operating at 60% capacity. So I actually had no choice but to go private. I had private health insurance, so I was in a position where I could do it. Yeah. But of course, you do think, well, not everybody's in that position.
No, and look, there are nearly 3 million people in our country who are off work, off sick. Many of them will be on NHS waiting lists that are still at historically high levels. And some of those people, like you, are voting with their feet and going private, either because they've got private medical insurance or they're in the position where they can pay to go private. There are also people, let's be honest, who can't afford to go private but are sticking it on a credit card because they're in a desperate state, like you were, of thinking, this isn't just about my health, this is about my work and my income and my career. So people are making those choices, finding them really hard choices in the process. And then I worry about the people who are not in a position to make that choice and are stuck suffering on waiting lists. And this is why, when I was in opposition and now we're in government, I've said where there is spare capacity in the private sector, we will use that spare capacity on NHS terms so that people get it free at the point of use. But if there's spare capacity up the road at the private hospital, you can go there.
And if the private hospital's cooperating with
that? They're up for that. They're already doing some of it. I think there's an ambition to do more. We want to work with them to have a kind of proper deal with the independent sector. I think, though, and this is where I get challenged from people on the left, they'll say, hang on a minute, using the private sector, this doesn't sound very Labour or left-wing to me. But for me, this is a fundamentally kind of left-wing argument, which is you should never be priced out of healthcare and you should never be disadvantaged on accessing healthcare because you lack the means. And of course, people are right to challenge and say, but hang on a minute, won't it be better value for money if we do it through the NHS? Shouldn't the NHS be there for us? Of course, that's right. But it's going to take time for me to build the capacity within the NHS and to recover the NHS from what is objectively the worst crisis in its history. And in the meantime, it doesn't sit well with my principles to see working class people left behind because they can't afford it. And I do not judge for a moment the choice you've made either, Iain, because I think sometimes people can get a bit on their high horses about this and kind of go, oh, we pay to go private. What are you supposed to do, especially given the job that you do and the direct link between your health and your
Before we talk about your speech today, just one bit of mystery shopper feedback. In the final, I was in a ward for about 3 days, and my bed was right opposite the nurses' station, so I had a great view of everything that went on, and it was all very efficient. And all that hospital stay, it was 6 days. Can't complain about anything, but I got to know the nurses, and one of them, who was a sort of older lady who was on a grade 2, and she basically said to me, she said, look, this hospital could run with just the grade 2s and the grade 5s. And then she told, and I watched all the things that she was doing. She had quite a responsible position, but she was being paid just above minimum wage. And I thought, this really is outrageous. Yeah. And she said the grade 8s, you could ditch all of them and nobody would notice any difference at all. As if by magic, this nurse appeared in a purple uniform, which indicated that she was probably sort of up there.
Yeah.
And she just said to them, she said, "Everything okay? Good. Thank you very much." And then she walked out again. I said, "Who was that?" She comes and does that every morning. We have no idea who she is. And she said, it's just sort of a job that someone's created which could easily be done away with.
And as part of these, we're going to be doing a big consultation on our NHS 10-year plan. Part of that is going to be making sure that we are genuinely engaging with staff on the front line. I want all of, because the interesting thing is, I'm always told, how are you going to reform the NHS? They hate it, they'll resist it. People who are working in the NHS are crying out for it. Because I've done loads and loads of visits since the general election, let alone before. And what's been fascinating when I've done kind of conversations with NHS staff, they're the ones that are pointing out the waste.
Yeah.
They're the ones that are pointing out the inefficiency. And they're angry about it too, because they're taxpayers, and also they really care about their patients, and anything that's getting in their way, they care about. So I think the staff are on my side on NHS reform, and we will get some really good ideas that will help us to strip through some of the bureaucracy, some of the red tape, some of the duplication and the waste.
And I hope
that we can't afford.
when you go on these hospital visits, which I'm sure you do all the time, one of the nurses said, whenever we get visits from VIPs, they never come and talk to the likes of us. Make sure you do that.
I mean, I always do, but the other thing is, I'm conscious, and I say this with great respect to senior managers who come around with me on visits. Wherever I can, I try and give them the slip and go a bit rogue. So I was at UCLH the other week with Keir, and obviously, it's bad enough when I turn up. When the Prime Minister turns up, it's just a huge event, and it was lovely for all the staff to have the Prime Minister there, talking to them, genuinely engaging
Depressing
and listening. No, behave. And Keir was genuinely there to listen. But what was great is that because of the natural circus you get around a prime ministerial visit with all the entourage and the security and everything else, I just managed to slip a few conversations on the sidelines with staff who weren't part of the formal visit, but were just passing by and having a chat. And those are great conversations because you do get proper warts and all feedback. And that's what I want. And I hope what people have seen from us already, especially with the Darzi investigation that we published last week, we are not in the business of pretending everything's okay when it's not. One of the reasons I said on day one the NHS is broken is that if you are honest about the challenge, you've then got half a chance of fixing it. When you have a culture of cover-up to protect either political reputations or organisational reputations, that's where the patient safety risk kicks in.
I see that, but if you constantly talk about the NHS being broken, when certainly from my experience, it isn't in many ways.
You went private, I'd say that.
From that perspective, yes. But from every other perspective, it was absolutely brilliant. And I think, we all judge things by our own experience of going to a GP or being in hospital. And I think most people do have a positive experience.
Well,
so it's this hackneyed old phrase, sort of talking things down. And I think there are a lot of people who work in the NHS who will take a bit of exception to being told that it's broken.
See, I've found the opposite, and of course, over 1.5 million people work in the NHS, so we're not going to get everyone singing from the same hymn sheet at all times. And actually, one of the things I've been trying to encourage is a culture where people can speak up. And I'm not looking for deference in this job. I hate being called Secretary of State everywhere I go. I'd much rather if people just kind of spoke to me plainly and simply. And what I found is people breathing a huge sigh of relief that the government isn't trying to pretend everything's all right. And one of the things I always try and stress is just because the organisation is going through its worst crisis, just because there are some absolutely shocking things about the way the NHS is currently running, that does not mean that every day there aren't outstanding people delivering great quality care, because that's happening every day in the NHS. It's one of the things that gives me heart about the future, is that we are seeing what the future of the NHS could look like with exceptional, outstanding practice. It's my job through the reform agenda to make the outstanding, exceptional practice in the NHS the ordinary, everyday experience.
I said something in my talk. Where's the beef, which I knew you would bristle at, but Keir Starmer made a big speech last week talking about reform. You've made this speech talking about reform, and it's full of sort of phrases like make changes with people and not to people. Well, who's going to disagree with that? Sticking plasters won't cut it. Who's going to disagree with that? If we don't act now, blah, blah, blah. Where is the beef? What do you mean by reform? Because it's a word that can mean anything to anybody.
It's both health service reform and public health reform, because we've got a sickness in our NHS that means it isn't always there for people when they need it. And we've got a sickness in society, which means that although we're living longer, we're becoming sicker sooner. And if we don't act now, both in terms of the immediate crisis in the NHS... Well, hang on, I'll come on to that. If we don't act now to deal with the immediate crisis, as well as take the right long-term decisions, not only are people going to be let down today, over the coming decades, with rising chronic disease, rising cost pressures and growing ageing society, the system will effectively go bust. So to tackle that situation, we've got to do three big things. The first is shift the centre of gravity in the NHS out of hospitals into the community. So better primary care, community services, mental health and social care. When I look at other countries' health systems and look at why their outcomes are better, we run pretty much top of the table for spending on hospitals. We underinvest in those other areas. And actually, if you can get a GP appointment, if you can get care in your own home, if you can find the mental health care when you need it and the social care when you need it, you are less likely to end up in hospital. You're more likely to get out of hospital quicker. If you find yourself in hospital, that's better for patients and better for taxpayers. Secondly, we've got to shift from the analogue health service we see today to a much more digitally and data-driven system.
Which will cost a lot of money.
There are definitely some costs associated with that, and I'll come on to talk about that. And the third thing is to move from sickness to prevention. And one of the reasons why we are going bold on public health, as the Prime Minister set out last week, is not because we want to wag our fingers and tell everyone how to live their lives or to be the fun police. I'm going to meet a friend in the pub straight after here, so that kind of tells you I'm a normal person who likes to do normal things like everyone else.
That's why you couldn't do the whole hour.
There's cake. I've blown my cover now. There's cake brought into the office today by a former health secretary, no less. So, look, we're not interested in being the fun police, but we've got to make sure we are taking real action on health, because otherwise we're going to ruin not only our lives, but also overwhelm the health service.
The Conservatives talked a lot about reform when they came in 2010, and they brought in the Lansley reforms, which I think even most Conservatives admit weren't exactly a success. But the NHS, I mean, it's called the National Health Service, so if you're going to reform it, it kind of inevitably means that there will be top-down reforms, as well as, hopefully, I mean, things like... I mean, we hear a lot of... I've just had to change GP surgery because my GP's retired. But this new surgery that I've gone to, I don't think I'm going to have an individual GP. It's going to be sort of whoever happens to be available, which I think is awful for continuity of care. I think Keir Starmer
especially at your age as well.
Thank you. You'll get there one day, possibly. I mean, I think Keir Starmer was making this point that people want to have their own GP. But you can't control that from the Department of Health, can you?
No, I think there are... I'm looking at this from two angles, really. Firstly, I believe very strongly that a lot of the change is going to come from below, and that there are lots of people in the system now who are showing us what the future looks like, whether they're pioneering new treatments, new technologies, whether they are organising services in different ways. For example, my local hospital, King George Hospital in Goodmayes, the consultant-led clinical team there, they have been busting through their backlog, not with loads more money being poured in, but organising their clinics more efficiently so they can get more patients through, using effectively kind of Formula One pit stop techniques. Now, I'm not going to come up with that idea. And by the way, what a frankly terrifying idea if I'm designing surgical pathways. But that clinician did, with a team around him, including nursing and other staff, backed by the executive leadership in his hospital. And what it's my job to do, a bit like a magpie swooping in and seeing, the thing that's working, is to make sure that we adopt and roll that out across the country. Because as I've regularly said, the NHS has got more pilots than the RAF. And if I focused on adoption and rollout, I'd be doing a hell of a lot of good straight away. I've also got to give them the tools to do the job. They are working with creaking, outdated IT. And this goes to your point about the cost of new technology and systems. One of the reasons why we keep on getting ballooning NHS budgets and deficits and overspending is because we've got that creaking, outdated infrastructure and we've got poor productivity in the system. And ironically, to plug those shortfalls, what do? We raid the capital and tech budgets to plug the shortfalls, and rinse and repeat happens over and over again. So with the spending review coming up, my focus and the Chancellor's focus is to say, even against the backdrop of there not being a lot of money at the moment and the big black hole to fill, let's prioritise the capital and tech investment that will help us to improve the experience and service to patients, the productivity of the system, the experience at work for staff, and that will help us to bring the day-to-day overspends back under control and means we won't raid capital and tech budgets. So we turn a vicious cycle into a virtuous circle.
Here's an idea, which I don't think would cost a huge amount of money, sort of a few $100,000 maybe. Why not create an internal website with the NHS, and you're not going to tell me it already exists, where
Probably
good practice can be shared. So something that a primary care trust in Liverpool does that really works, everybody else can learn from it. And I don't know whether that exists at the moment.
I'm sure that there are people who try and do that, but evidently it is not working. It is too complicated, and we've ended up in a situation where I think because the state of the system is so poor, people have felt overwhelmed, and we've lost, I think, some of the ambition in health and care reform. I mean, some of the Tories, even before the election, were admitting, including, Robert Jenrick standing for the leadership now, he was actually saying before the election, look, Labour's got a better chance of reforming the NHS than we do. And certainly I had lots of Conservatives saying, look, we don't want to touch this with a barge pole because of the Lansley reforms, and this is so toxic for our party, we won't touch it. So they put party before country. This side of the election, I think people know where Labour stands on the NHS. They trust us with the NHS, and we've got both the licence and the mandate to reform the NHS, but also there's a lot of hope back in the system now, a lot of goodwill. People are really up for it. And I find people right across the system, wherever they work, whether in hospitals or in general practice or community services, they agree with those three big shifts we describe. What I want to do is something truly radical, which is turn those laudable ambitions into real action. And the delivery really would be radical, because so far we've heard lots of this before. And by the way, I acknowledge your cynicism. I acknowledge the cynicism that's probably pouring in the text messages, and we're here on the call.
I try not to be cynical, because I think that, you do talk a good game, but I said on a programme, I think I said on Newsnight last week, I actually do believe that you have got the wherewithal and the ability to do this. And I wish you luck in it, because if you can't do it, I just do worry about where we'll end up.
Yeah, and that we know we're going to be judged by actions, ultimately. People at the election chose change. They've given us the chance. They've given us the mandate. Yes, the money is tight, and I know there's realism in the realism bordering on pessimism in the country at the moment. I'd say that people know we're not going to fix it overnight. People fear whether we're going to be able to fix it at all. And I want to make sure that by the next general election, people can see significant improvement, so that they will give us the chance to finish the job. Keir's been honest about some of the fact that, some of the challenges in health and care are, that they took over a decade to create in terms of these problems. They're going to take a decade to fix in some cases. We will only get the mandate to finish the job if we prove in this term that we can deliver. And that's the responsibility that's resting on my shoulders.
Well, Sue says, listen to your listeners. You're just listening to the politicians. Well, I do listen to my listeners, and we're going to do that for the rest of the hour. Wes Streeting, thank you very much for joining us. That's
probably the comms team outside texting in to get me off air.
And you can
say anything like put my foot in it.
No and black.
Well, it's good to see you back in good health, Ian. We've missed you on the airwaves, so it's a genuine pleasure to come in and talk to you, even if you've given me a bit of a challenge. I embrace it.
Very, very polite.
You have been.
Thank you very much indeed. You're listening to LBC. It's 23 minutes past 7.
This is LBC.